Hey, this is Joab.
Hey, Joab, what's going on?
I'm just making sure I can know how this thing works.
So I went ahead and made you co-host. So when I exit, you will continue on.
Okay.
That's it.
Well, if it gets all screwed up, I'll blame you.
We have about 65 people that will be calling in, so hang tight, okay?
Yep. I forwarded the appointment to Tallboy. He's going to join us.
Excellent.
So I just want to let you know that.
Thank you. Okay, I'm stepping out for a quick second.
Sure.
Joab, you also have the authority to let people in when they're in the waiting room? Joab, you'll also be able to let people in the waiting room?
Yeah, I heard you. I'll let them in.
Okay, great.
got up, showered, did my hair, put makeup on, all that. And then I was meeting with the HR person, the hiring manager. The hiring manager was on video. The HR lady turned hers off. I'm like, oh.
Hey, Joab, how are you?
Hey, Greg, how's it going?
Going well. Yeah.
I'm here.
Yes. Yeah. Same here.
Hey, I saw you on TV today.
Uh-oh. What did I do?
You were talking about the community college on
Oh, yeah.
41.
The spotlight or something.
Yeah, they did a
Yeah.
spotlight on what you're doing. I thought that was really good. It was a really good presentation.
Oh, good. Thanks.
Yeah. Good looking guy on TV giving his spiel. I like it.
Yeah, I don't know about that, but we do what we can.
That's right.
Yeah.
Gives out a little love fest.
Well, did I lose it or did I?
Are we
Okay. We got some folks that are muted and some that aren't. I'm not going to mute you. So if you care to speak, now is your chance. We're going to get started here in just a little bit. We've got about 5 minutes or so. So I want to thank everybody for getting on the call, and we'll get started here in a little bit.
Mark's been staying with the neighbors for a while. I kind of forgot he was up there. But he's going to see it, I think.
Oh, I wondered what happened to him.
I kind of forgot about it, but he took the bar for a while ago. He said,
Hey, Kathy, how are you?
Good. How are you?
Good, good. I'm glad it's cold out, because then I'd really be, sick to go outside. But because it's cold, I don't mind it as much. But the sunny weather is a little misleading, that's for sure.
It is. I know. I still go for a walk every morning for about 10 o'clock or so. I get to that point of I got to go for a walk. So.
Yeah. No, I understand that. I've been trying to get out at least once a day and get my legs stretched, because it does get a little intense when you're in the house so much. So
then it feels better to come back and sit for a while. So.
That's
but
true.
we live on 12 acres in the country. So, I mean, even walking up my street and back is a mile. So.
Oh, yeah.
And
Wow.
there's nobody out. So.
So did he haul something over there again or something? Or
I think he's mowing.
oh,
I think he was on the mower and he went down. I don't know. I don't know for sure.
well, I saw that he had mowed a section up there, and then it was like, okay.
He's mowing and then
How you doing, Mayor?
think he just rode the mower over there. Yeah, we've got some new best friends over here.
Oh, do ya?
Oh, yeah. Yeah.
I love when you have good neighbors.
Yeah. Well, considering we've not really had neighbors for many years.
I mean, it's not like probably our closest couple friends.
Did you have some lunch before you came out?
I did.
That's what everybody was doing on the call. We would normally be at a restaurant, and so we would have lunch anyway.
Okay, so I've muted everyone now. I'm going to unmute the mayor and Daniel.
Good morning.
Morning, sir. Let's just give him a
Well,
couple
good
more
afternoon,
minutes.
I should say. It
Yeah,
all
good
blends
afternoon.
together.
Give us a couple more minutes. We're going to let a few more folks get on, but I went ahead and muted everybody out. So we'll get started here in just a minute. Daniel, we'll let you get us started, and then we'll go from there.
Okay, you want to give it a few minutes or go ahead?
Yeah, let's give it another minute or two just to make sure, because I noticed people are still getting on. So
Yeah, and we had about 65 RSVPs, and so we're about halfway there.
okay. Okay, Daniel, we're a couple minutes into this. You want to go ahead and get us started, and then I'll just make sure we let everyone in.
Okay, sounds good. Hello, everyone. Good afternoon. Daniel Silva with the KCK Chamber here. I want to thank all of you for calling in today, joining our Zoom call for a COVID-19 and business update from Mayor Alvey. Mayor Alvey, I want to thank you for participating with us today. As you can see by a number of folks calling in, there's tremendous interest in hearing directly from you. As a chamber, we've definitely worked hard to connect our members to the right people that have the credible information. There's a lot of stuff floating around out there, and we want to make sure that our members are getting it firsthand from the folks making the decisions. I also want to thank you for your leadership throughout this whole ordeal. It's been greatly appreciated. At this point, I'd like to turn it over to Joab Ortiz with Brenda McDonald. He is our 2020 KCK Chamber Board Chair. Joab.
Thank you, Daniel. I'd like to thank everyone for being on the call today, and especially thank the mayor for allowing us this time to share information with us regarding how things are going, especially from a small business perspective and a business perspective. I know there's a lot of concerns, and I really appreciate all that he's done. The leadership and guidance that we've seen from the mayor has been very well received. I think it's been very timely and greatly appreciated. On behalf of the board, I know that we're working hard with the chamber to make sure that we are meeting the needs of the community, whether they're members or not. We're promoting business, we're promoting opportunities, a lot of it electronically, and we're going to continue to do so. I don't want to share, this isn't my presentation. This is about the mayor and his opportunity to share with you all. So I'm going to go ahead and turn it over to him. But before I do, Mr. Mayor, I want to say thank you for all that you've done and all that you continue to do for us. I know that you're working a lot of hours and putting in a lot of time, and it is greatly appreciated. So with that, I'm going to turn it over to you.
Thank you, Joab. Thank you, Joab. Thank you all for attending this. And I want to say the thanks to, the leadership throughout this has been really across the community. And every time that a business person, a business leader, an elected official or an individual in their home, it complies with the stay-at-home order or makes accommodations to allow essential employees to conduct what they're doing in a healthy, sanitary way is a real demonstration of leadership. And I think, to me, that's been one of the most encouraging experiences throughout this time, is that we, as a community, I believe, and really a group of communities, we have been looking for ways to really flatten the curve, to really help us get out of this crisis. I think maybe we surprised ourselves in our capacity to do this. I would say that I think our real challenge now is following through. And one of those things where when we were first confronted with this crisis, that we could all get on board and really, and you could tell that word, that necessity of working together, of coming into compliance, spread throughout the community, and from large businesses to small businesses, individuals, families, religious congregations, schools, you name it. Everybody has had a part of this, and everybody needs to play this part. And now we're at this place where we need to continue to stay with it, to follow through. So one of the difficulties, I think, throughout this has been that, you cannot see, I'd like to say we could see 4 weeks into the future. I don't think we can see 4 weeks into the future. 6 weeks, not 6 months. So the question is, well, how long will the order be in place, and it will be the next steps? I keep coming back to, just as we moved into this and began to ramp up and kind of climb, the apex, and the measures we took bit by bit to try and stay ahead of this, we only had 2 to 3 weeks of foresight, and that was what we were able to see was what was happening or had happened already in other locations across the country and really across the world. So we were really taking our readings from what had happened elsewhere and what we needed to do to get out in front of this. It was interesting this morning watching the news. The mayor of Sioux Falls, South Dakota, says, and he's in kind of a little disagreement with the governor of South Dakota. They have the Smithfield plant there. I think they had 400, maybe 600 infected people there. And the governor is not going to issue a stay-at-home order. The mayor is feeling like he needs to do something. And he said something that sounds exactly what we were saying just 3 weeks ago. He said he'd rather be chastised for doing too much than castigated for not doing enough. And that's really where we are. The situation with, and one of the things I keep saying throughout this is, I don't know where we're going to be in 3 weeks, 4 weeks, 5 weeks. All I know is we have to watch the virus. The virus is the virus. It is going to do what it does. We have to pay attention to the virus, what it is, what it does, how it moves, and we have to take our readings from it. And that's the fundamental here. All the political considerations, the economic considerations, the social considerations really depend upon watching the virus and letting it reveal to us what it is and what it's going to do. And we're just, because we don't have the testing, we cannot identify those individuals or those pockets of infection, isolate them, treat them, and keep them from infecting others. We just don't have the testing. That's a failure of the system as we moved into this, and we're still playing catch up. We still don't have enough testing to get the data we need to really stay out in front of it. We can do some, there's a thing that's being done by the University of Hong Kong called nowcasting, where they take the daily data and they do some other things, and they were able to extrapolate from that what they think the trends will be. But again, lacking the testing capacity to get those results in real time, to know today or tomorrow what the real-time transmission of the virus is, puts us in a position where you have to plan for the worst case scenario. It's interesting to me that after SARS 2003, Singapore and I believe Korea and Taiwan, South Korea and Taiwan, came up with first of all, they have the testing capacity, they have the personal protective equipment, they have infrared thermometers, they have the policies in place, they have the personnel in place, that when someone, first of all, identify those individuals who are infected, they have the capacity to isolate them. Singapore never got to the point where they closed bars and restaurants. Now that's fascinating to me. That tells me that they have enough communication and preparation throughout their population and the compliance to be able to say, well, we know this is a threat, and we're going to test everybody. When you come into a restaurant, you get your temperature taken. If you have a temperature, you're not just allowed to get back on public transit. You have to get home individually in a protected way. They will send someone out 5 times a day to make sure you are quarantined. And they did this because, and people cooperate with this because they said, we don't want to close bars and restaurants. We don't want to close businesses. So we're going to take these measures now to stop the spread, and people comply and are on board with that. And they know they have the tools. So in very concentrated, focused ways, they have very stringent measures, but that allows them to avoid the widespread shutdown of businesses. I would say coming out of this, if our nation does not come up with similar kinds of strategies and have the resources in place ready to be deployed to respond similarly to stop the spread, shame on us. I mean, it's one thing that we're not there now, but if we go into the next crisis like this, which will very likely will be more, then then there's no excuse for that. So as we move through this, I have to say, we kept saying, well, we will do what we must do, nothing less, nothing more. And because we did not have the testing capacity, because we did not have that data, we had to adopt measures like closing schools, closing bars and restaurants, and then ultimately the stay-at-home order because we didn't have the data. If we had the testing capacity, we would be much more able to identify and isolate and treat and prevent the spread from those small pockets. But without that data, we just can't do it. As we're trying to move forward now, and we're saying the governor, I think, is going to have a press conference today, I think, at 2:00. I'm not sure if she'll address this, but I was on the phone with her yesterday to ask what was her disposition in terms of the stay-at-home order for the state of Kansas, because it expires on the 19th. I know I can't say when she's going to lift that stay-at-home order, but it's based upon a model that they're using, which is different than the model that our public health department is using. Their model is saying that the peak will be in Kansas the 21st or 22nd. Now, it's not clear to me whether that model was for Kansas as a whole. So maybe Kansas as a whole will peak 21st or 22nd, or it was certainly not just for our region. And the model we are operating under is looking at a peak maybe the 28th or 29th of April. Our public health director, our chief medical officer, Alan Greiner, in conversations with the public health directors of the metro area yesterday after a Mid-America Coordinating Council group agreed that what we really should be doing is once we hit that peak, before we lift the order, there should be a 14-day period lapse after that peak to allow what they think is perhaps by and large, the longest period of incubation for the virus. So if you hit your peak on the 28th or 29th, then you'd be looking at 14 days after that before you would loosen the restrictions. The governor's model is looking at 21st or 22nd, and they're not even looking at 14 days out from that. But she's gonna have to speak to that herself. So I have a real concern about that because, as you know, the demographics of our county are such that our mortality rate is high because of the ongoing health problems of our community. We have, again, we're at 102nd, 103rd, 102nd ranking out of 104, 105 counties in Kansas. Maybe it's 99th now. We still have, high, heart disease, pulmonary diseases, diabetes, higher rates of those. So our morbidity rate is much higher. And we have a more vulnerable population because of our age as well. So the concern I have is if the state of Kansas eases the restrictions prior to the time that is optimal for us, I think that puts us at greater risk. At the same time, if the city of Kansas City, Kansas, or Wyandotte County were to try and keep its stay-at-home order in place beyond the time the governor is suggesting, then it's not clear what Johnson County will do, or Leavenworth County, Douglas County.
Mayor Alvey,
It would be effective for us to continue to I'm sorry, did I get lost there?
No, I was gonna share with you, some folks have commented that I believe that the Governor Kelly has announced an extension through May 3rd.
That's it. Okay, so she has announced that. All right, thank you. I had not heard that. So that's the problem. At May 3rd, if even at a May 21st peak, we don't think our peak is going to hit until the 28th or 29th, and you want to have our public health is recommending a 14-day period after that before there is easing of the restrictions. We're going to put our folks at risk again. At the same time, if we keep our stay-at-home order and Johnson County does not, and they're indicating they are not, they would go with the May 3rd, then would that be effective? So what I've asked for Dr. Greiner, our chief medical officer, to do is we knew and know that as we release these restrictions, there's going to need to be guidelines. There's going to be a need a framework. There's going to be kind of a set of best practices for continuing to conduct businesses to protect our community. Let's put those in place. Let's get those worked up into a framework. And I think Governor Kelly is going to be doing the same. And as a set of recommendations and guidelines for businesses so that we can actually evaluate, are these going to be effective? As if you go back, again, the purpose in the restrictions were never, the intention was not to stop the virus completely, because that over in a 4-week, 6-week period, that was never the intent. The intent was to flatten the curve, to reduce the amount of infections so we would not overwhelm our healthcare system. That was its purpose, and that's why we did those things. So if we can follow that May 3rd date and come out with a set of guidelines and recommendations and best practices that have already been implemented by businesses and governments and not-for-profits and schools really all across the country, if we can come up with those and they can be confident that that's going to keep that curve from spiking again, then perhaps we would join that May 3rd. But however, I have to say, I'm very reluctant to recommend, if our public health officials say that the best way to protect our community is to continue on with the stay-at-home order after that May 3rd, then we're gonna have to seriously look at that. Because again, as I said, as the mayor of Sioux Falls is discovering himself, I'd rather be chastised for doing too much than castigated for we're not doing enough. And our responsibility is to take care of our community. And we have a special, 65% of those who have died from the virus, of the 31 people who have died in our community, have been African American. Now that tells us something. So we very careful with this and understand that we're going to have to take whatever measures necessary to protect our community.
So I want to allow folks to ask questions. I know that we've got a lot on the call. We've got almost 70 people on the call right now. So if you have questions, if you'll look at the bottom of your screen where it says chat, you can click on that, open up the chat. Let me know and I will either ask the question for you or I can unmute you so that you can ask the question. I don't want to unmute everybody and then we'll get an influx and it'll be hard to decide to figure out who's speaking. So if you could do that. Ms. Mary, you talked about the 28th or 29th being the top of our curve. That would leave a date of the 13th, thereabouts, being where things would loosen up. Can you talk a little bit about how how we're planning on loosening that up once we get to that point, what that's going to look like?
Right. Good. Yeah, that's the right question. And that's what I'm asking from Dr. Greiner and from others to tell us, okay, again, based upon the experience that others, and I've not had a chance to look really at, I know Governor Newsom of California has announced a framework for easing restrictions from their stay-at-home order. We're going to be looking to them as well as to what happened in Washington and really even in China, though. Frankly, because of the lack of data, I don't, frankly, don't trust the experience of China because it has been, packaged in such a way we're not getting the full story there. So, but the real experience we might find from Germany, from France, other places, what has been the experience in how they reduce these restrictions? I think one of the things we're going to do is those businesses who have already begun to implement are going to be finding out that, we've had people who work from home, stay at home. I think that's going to become more normal. If I don't need to, frankly, if I have a business that requires a lot of people to be in or has a lot of people in office, when my lease comes up, I'm going to ask myself, how much space do I really need to lease? How much can I accommodate at home? And when those people are in the office, what are the measures they're going to have to do? That social distancing, we think, could easily require us to move another year or 2 years down, depending upon the progress of the vaccine. So I have to say, I don't know what it's going to look like. I think it's, first of all, it has to incorporate the best practices that have already been developed by businesses all over the nation and really the world to say, well, these are the things we can do to continue to conduct business or our operations, and this is what we're going to stay with. Again, because I think we anticipate this virus, again, it will tell us what it will do, and it mutates pretty quickly, that whether we can get the herd immunity is a real question. There could be a mutated version of this which comes back and hit us all over again. So I think what Dr. Greiner and others are going to be doing is researching those things, looking at these frameworks to see what is already happening, what can happen, and then come up with a set of recommendations for that.
Question, if Johnson County businesses open following the governor's orders, how can we possibly stay relevant or better yet protect our Wyandotte County business environment?
And that is an excellent question. And that's an excellent question. And really the predicament that if Johnson County decides to go with the May 3rd order and start opening things up, frankly, people will talk all the time that, I talk to kids all the time, and not kids anymore, they're grown up, but they'll say, yeah, if you go to Johnson County, sometimes they pull you over, it's driving while black, right? And my family has experience going to Johnson County and being pulled over driving while Wyandotte County. And I have real concerns if our folks decide, if we keep the restrictions here, and our folks start going into Johnson County to shop to do the things that we may not allow here if we keep the order in place, when they get out of their car and people see they have WyCo plates, what will be the perception of them? They're going to be perceived, well, you're not healthy there, you're not clean, you're not sanitary, you're not safe. That's why you still have to have the restrictions. Those kind of dynamics are in play already on race and economic, social background. It's going to come into play now over this issue of the health. So we'd have to be very careful if we were to keep those restrictions in place, because it would force some folks who want to move on to go to Johnson County to shop. And that's a really difficult place for us to be. So I'm really concerned about this. This is why it's important for us and for the medical community to really take the lead on this, to say, well, these are the kinds of, as we back down out of these are the kinds of restrictions or guidelines for operating your business or conducting business that you need to follow. And if we do these things voluntarily and enforce them as well, then we're going to be able to keep that curve flattened and not overwhelm the healthcare system, which has been the objective all along. We do not eliminate the virus. That's not going to happen in the short term. But what these measures were meant to do from the very beginning was to prevent the overload to our healthcare system. We believe we're achieving that, and that's because of the really good compliance we've had. But as we move forward now, how do we ease those restrictions, if that's what we do, in such a way that we keep that from happening again? And I think I want people to think about this. This has been a great stress on the economic structure, the political structure, the social structure, of not just of Kansas City, but of our nation and really the world. If our healthcare system were to be overwhelmed, as it has been in some places where we cannot provide care, and that people are simply left in triage and saying, certain people, like they did in Italy, you at the age of 80, over 80, you're not getting intubated. If you were, then it became over the age of 70. Then it became over the age of 60. That's a horrible message to send to the people of our nation, that they cannot get the care they need. What will that do to our businesses? What will that do to our political structure, economic structure as a whole? I think that's a very grave danger that we needed to avoid at all costs. It's just that one piece of our fabric, our social fabric, which is our healthcare. If that really gets overwhelmed, it sends ripple effects across all the economy, all the political structure, the social structure, and we need to avoid that at all costs.
I have a comment from Senator Petty. I'm going to unmute her. So, Senator Petty.
We actually are not seeing.
Sorry, I was listening to the governor at the same time I'm listening to the mayor. I just appreciate the mayor taking the time to update the chamber and the rest of us that are joining as well. I was curious as to whether the mayor and the commission have had a discussion about UG offices and how are they able to handle the capacity of work that they have going on, and are they looking at a plan for opening any of those now?
Right. No, no. I mean, I think we're constantly. We believe that we spent really the first 2 weeks of every day in conversation on operations, making sure, and that was every day, including weekends, trying to make sure that we could do what we needed to do remotely, and sent all those we needed to home to protect them. I had to insist with my staff to stay at home, because the urge, especially in the political environment, as you know, is to make personal contact, and you want to be around and be able to, see people right away and read body language and facial cues, all that kind of thing, which we're not able to do on phone. So, but I think what we've learned is there are certain things that simply cannot be done from home and require people to be present. As much as possible, we move that out, again, to reduce risk to our employees. So as we move forward, I think we're going to be looking at very clearly, well, which of these do we need to continue? Because again, the virus doesn't, what I just saw today, which was a different description than I did before, the virus, gradually, even though it's exponential, takes hold. But when it begins to decline, it's a much more gradual decline, and it's going to persist. And so as you approach, let's say you get 2 weeks out, so we're just more than 2 weeks out from what we anticipate the peak based upon our models. Well, 2 weeks after that is we're going to be in the same situation we are now in terms of numbers. In fact, we might be actually less. Even in a worse shape. So it's the virus. Well, the virus will tell us what we can do and what we can't do. And we have to let the virus speak. We have to keep our eyes on it. We got to let the scientific evidence, the data show us what we can do, what we can't do, what we must do. And it's going to show us the way. Again, the fundamental here is the virus. Let's just pay attention to it. And all the other considerations have to make sure that we don't allow this to overwhelm our healthcare system.
So given that scenario and the fact that if, you look 2 weeks out, if we get to that May 13th date, that tentative date, if we were to go 2 weeks after the April 29th and to say, okay, that's where we are today compared to where we were then. And we've been in this thing for quite some time already. Right. Conceivably that curve we could see some form of isolation or distancing lasting into June in that scenario. Is that the worst case approach that you're taking, or is there something, are you looking at something in June? How are we planning that out?
Right. Yeah. Again, we get 2 weeks. We can see out 2 weeks, maybe 3 weeks. And so even, in the conversation with Governor Kelly yesterday, so she said then it was going to be May 3rd. But even in these next those 2 weeks leading up to that, they're going to be continuing to look to see what the progression of the virus is to make any adjustments necessary. So no one has locally anything better than maybe a 2 week view. Now, if you look regionally, if you look nationally at experiences elsewhere, it can kind of give you an indication, but it still depends upon the level of compliance with the social distancing and all those of the stay-at-home order. So the problem is the lag time. And again, because we don't have robust enough testing, it's very hard to take the data we have and extrapolate from that to get solid evidence. But you can get closer to it, but you can't get what you would do if you had the real testing capacity. When I say what kind of measures we'll take, the question would be, for instance, would we allow, so manufacturing, would General Motors reopen? It's possible, if they have the right mitigation measures, if they take everybody's temperature as they come into the plant, if as soon as somebody has a symptom, they send them home, if they were to, especially if they could disinfect every day, which is hard to do in a large plant like that, then those things might reopen. Bars and restaurants, it's a different matter. Sporting KC, that's a different matter. Anytime you put people in close contact with one another and one person comes in with the virus, they can spread it even if they're not showing any symptoms at all. In fact, 20% of all transmission comes from people who are asymptomatic. They don't know they have the virus and they're viral shedding, and that's how these pockets begin. So we're going to have to back down from this slowly to see what would our public health officials recommend are the things we can do to prevent the overload to the system, the healthcare system, and yet reopen those things that we all become accustomed to. How do we do that? That's really, I have to say, in my opinion, that's kind of a week to week or 2 week to 2 week. There's just no 4-6 weeks out there. And even if Italy does have some success in doing this, or Singapore, it still depends upon our compliance with stay at home and with social distancing and sanitation, all those things, which is why the voluntary compliance has been so key for us.
So you've mentioned several times about testing, and testing seems to be a critical issue. Can you talk a little bit about where we're headed with testing from your understanding, and where we could be in the near term, long term? What's it looking like?
Yeah, near term is about where we are now. We'll be getting more testing kits, but it's not going to be sufficient enough for us to really use the same kinds of intervention that has happened, like I say, in Singapore, because they have those things in storage. They have those ready to go. We simply do not. Again, my feelings on this is, if we reach next fall and we don't have the capacity to put into place the measures that Singapore and Taiwan and South Korea use, shame on us, because we ought to be able to nationally ramp up production necessary to do those things. And you know, everybody's fighting for these testing kits, and you know, outbidding one another to get them. In fact, we find ourselves bidding against the United States government for these sometimes when a contract becomes available. Now, there may be some changes made in how these tests are conducted, so there's some promising things, but until those things show up in large numbers, the testing, we're still going to be operating out of, without that testing, without that data, we have to assume, you know, very serious conditions.
I have a question here. Give me just a second. Deborah, I'm going to unmute you so you can ask your question. Deborah, oh, sorry. Let me try that again. See if I can do it right.
So I think, is this Deborah?
Okay, yes.
There you go. Now you're on.
Yes. Who will be trained on how to administrate the test, and how will they be trained? By who will they be trained? And who all is going to be able to, well, employers, who all gets to have the test so they can test people coming into their sites or their locations or people that they're interacting with?
Well, I don't think there's going to be testing available to every business just to say whoever comes in is going to get tested. You know, the test I've seen, a lot of them are, you know, they're painful, in fact. You know, they insert the swab all the way up into your nasal cavity, way beyond. I mean, it's up behind the eye. It's not a pleasant experience. So what we do have is, health department is testing and has a testing center available, drive-through 5 days a week. There is, again, if you get a referral from your primary care provider, you can go to Dr. Sharon Lee's clinic on Southwest Boulevard. But it's not going to be available to businesses to be able to test people as they come in. It's not that. Now, if they come up with an immediate test, but they think they're working on some of those, that might be something else. But I don't think people, when they come into a business, to a place, are going to be, we would just be tested there. I think it's going to be, they might take your temperature, right? Infrared thermometers, take your temperature. They do a lot of that in Singapore. You come into a business or restaurant, they use that infrared thermometer, and if you have a fever, you don't enter. I think really the testing when it first comes in is going to be used by public health to try and get a read on where those real pockets of infection are and really target treatment to them and target quarantining to those folks.
Thank you, Deb, for asking that question, and thank you, Mayor, for the answer. Does anyone else have any other questions? Feel free to type them in or let me know. I can open up your mic. I just don't want to open up everybody's mic because then, you know, we might get over speaking. It'd be hard to tell who's talking. Regarding the different scenarios that you've painted out, especially like in Singapore, where they're testing people or they're taking their temperature when they walk into a restaurant or something along those lines, are those the types of policies or things that we're looking at implementing going forward in order to restart business? I mean, I understand testing is part of that, but there's other things that can be done to mitigate some of these issues. Are those things that are being looked at, and how are they going to be developed into some kind of policy or some kind of ordinance?
Right. Yeah, those are exactly the kinds of things that are being looked at all over the place. And that's what the public health directors in the region are going to be looking at. Any measure at all to try and, again, identify those individuals who and to prevent the spread of the disease. It's going to be best practices. What are businesses that are essential already doing to prevent the spread of the disease? You know, I'm sure it's wiping down countertops again, wiping down surfaces, making sure there's plenty of hand sanitizer, making sure people stay 6 feet away. You know, you go to Costco now, and you know, that's the most regimented experience I've had since I was in the Jesuit. You know, every step is really monitored, and in order to, those are successful. And so that's what we need to do. We also know what's not successful. What's not successful is people staying within 6 feet of each other for 10 minutes or more in an enclosed space. You know, if someone sneezes, you know, that depending upon who you read, that virus can be suspended in air for up to 30 minutes. These are all the things that, you know, what's been really helpful is the way in which businesses and not-for-profits and churches and schools have taken this seriously and said, this is what are we dealing with? We're dealing with a virus. How do we stop the virus? We do these things. Insofar as everybody keeps the focus on that, we're going to be able to continue to keep that curve where it doesn't spike and overwhelm our healthcare system. So I think when and how this has got to be done, I think it's got to be done before the May 3rd, just so we can evaluate really whether we think they'll be sufficiently effective to prevent another spike, to prevent a spike to our infections.
Teresa has a question. Does the unified government plan to support any antibody testing to assist with the reopening and back-to-back work determination? So can you talk a little bit about the antibody testing versus the, the different types of testing, and then the reopening and the back-to-work determinations, how that's going to go?
Yeah, I'm sure they're going to be looking at all those things, antibody testing to see and really determine. I'm not sure that they know, in fact, whether the antibodies, how long the antibodies in the body are effective to combat the virus. There's so much that's unknown, and but I have to tell you, Dr. Greiner and others are going to take a very deep, broad look at this to see everything that can be done and should be done. And they always have consistently through this given us solid rationale for every action that has been taken. And I'm going to continue to rely upon them for that leadership.
So one of the things that I know that we're looking at, and this is a comment as well as, you know, and we've been talking about how do we do, because we are an essential business and we're continuing to work I think if you look at some of the construction sites where we're doing temperature checks before people come onto the construction site and afterwards, I think those are the types of measures that we're wanting to kind of compile that information and share that with you all. I know that the chamber is also going to be looking at that for all the folks that are on the call, of gathering that information from those that are currently operating. What are those safe practices you're currently utilizing? Because I do think there needs to be somewhat of a balance of, okay, here are the things that we can do that we know that will protect community while still keeping the machine running. And so
Yeah.
those are the kinds of things that we're looking at right now. So for those that are on the call and have that kind of feedback and want to provide that to the mayor, the chamber is going to be collecting that information as well. There is a question. The stay-at-home order, are we syncing that up metro-wide? I know we've talked about Kansas being until the 3rd. What's it look like on the Missouri side? How does that look for the metro area?
So there is a core 4 meeting after this meeting, in fact, and my gut feeling is, my understanding is, and I did speak with the Jackson County Executive Frank White this morning. His inclination is that, based upon, again, what the public health directors from within the Kansas City region are recommending, is that we would adopt a 14-day period after the peak, which again, the governor's recommendation now or decision makes that problematic. Though again, she did state very clearly that as data continues to come in, that May 3rd date could change. So I feel that probably Jackson County as a whole and Kansas City, Missouri especially, will continue to follow the directions of the public health directors of the region. And this is why and I will say, my understanding is the Johnson County Chief Medical Officer is in agreement, but I think it's an issue with the political leadership. And I have to say, this is what I want people to understand, is there's also a real concern that if we don't relax and we don't, as you use the name, the reference of the machinery moving, well, then that does put a strain on people's livelihoods, which obviously affects health. And it also ultimately affects the very capacity of the healthcare system itself. I know that University of Kansas health system, as well as Providence, their revenues are going to be severely impacted by this because they're not able to do any elective surgeries. They're not being able to do those other things, and they're having to spend a lot of resources coping with COVID. So again, I have to remind folks, the goal in all this was never to kill the virus outright. It was to prevent the overwhelming of our system. And whatever we can do to make sure that we don't overwhelm the system, that's what we'll do. Do we need to do more than that? Maybe not. Do we need to do less than that? Should not. But we have to do what we need to do, but no more, no less. Again, in Wyandotte County, we have to look at our situation. Again, 65% of those who've died in Wyandotte County have been African American. That's a significant, and we cannot move past that fact.
So a couple different questions there. But first, let me state that Senator Petty has sent me a message saying that the governor has announced that we're matched up with Missouri. But I believe there is also that regional 4 who are looking at possibly planting a flag a little bit further down the line and then seeing if the states actually catch up. Is that kind of the understanding that I'm getting here?
No, I don't. Yeah, I don't know that my feeling, and my approach on this, I don't know what the approach maybe of Frank White or Quentin Lucas might be, but I'm not doing anything to try and move the state to do one thing or another. I just think it all needs to come back down to the data, to the scientific data, to say where we are. And if the difference in modeling that the state of Kansas is using. I don't know what that is, compared to ours. We just believe the modeling we're using is showing a peak of 28th or 29th. The state of Kansas shows a 21st or 22nd. Not sure what that modeling is. Dr. Greiner was not aware what that modeling is. So, by my understanding from Jackson County, and again, we have a Core 4 meeting here in just in about 10 minutes, is what is our approach going to be? And I think I would like to see Johnson County get on board, but I'm really not confident that's going to happen.
Right. Well, and we can come back to that, but I want to make sure that we get an opportunity to address the diversity issue, which is the African Americans are the 65% of the folks that are getting sick are from the African American community. How are we and how can we, with the unified government, work on addressing this issue, because this is systemic through a lot of other issues related to health and wellness. What are we looking at now and into the future to curb that specifically within the diverse communities?
Right. So Dr. Greiner and the Wyandotte County Health Department, this grew kind of out of the CHIPS, the CHIP program, the Community Health Improvement Plan. But specifically on COVID, what COVID has done is really exposed those disparities in health outcomes. And so Dr. Greiner and the Health Department have convened a health equity task force specifically focused upon the COVID virus. And they had their first meeting yesterday, and I actually have not had a chance to talk to him about other than to hear a report from him that was very well, and they're trying to expand the number of people who are engaged in that so that they can come up with some real recommendations, because this is a long-standing problem for our community, but really for the nation. We have to address those disparities, and it has so much to do with economic disparities as well. When people are poor, they have poor health. It's just a matter of fact. And if we can find ways to improve wealth, increase wealth for all of our population, for the poorest areas of our metro area, it is only going to enrich all of us. The fact that if poor people get more wealthy, that doesn't take wealth away from the wealthy. It actually just increases wealth for the wealthy. And this idea that there's only so much and I got to grab my share in order to, because there's only so much to go around, it just doesn't make any sense. If we empower and can find a way to build wealth among our poorest communities, then it's going to grow everybody. There's just no way. That's just a simple fact. I think that's a fundamental, but I think unfortunately too many of us don't believe that.
And then coming back to the date, and I know that there's been a lot of questions about, well, how is this going to open and how are we going to be able to do this? What I think I'm hearing you say is that we're not really looking at setting a deadline to reopen business. We're looking at points where we can reevaluate and determine what is our next, how much further do we need to push this, or what are the adjustments we need to make just shortly thereafter.
Yeah, so let me answer this, and then I've got to go to jump on another call. I think that's exactly right. Again, the virus is going to tell us what we need to do, and we're going to do whatever we can to try and get things back to normal. The one limit on that is, again, to keep that curve in such a way that it does not spike and overwhelm our healthcare system. That's the governor, it's the regulator on this. It's going to regulate how we move forward. We have to keep that in mind. But we knew that we were going to need to come up with whatever measures as we come off the curve, as we start releasing those restrictions. We knew we needed to come up with those measures, those recommendations, those guidelines. I've asked Dr. Greiner, work on those now. Let's develop those now so that we have them. We're going to have them eventually. Let's do it now so we can actually evaluate whether these work. And that's why it's going to be really important for us to reach out to all of you as businesses, what has worked for you? What does not work? What do you need to have in order to continue operating? And let's solve for these, because these things are not going away.
So, and to that end, the last question or the last comment was about residents who speak different languages. We have a lot of different languages within our community. How can the city and the school district provide helpful information on the distancing, the medical support, the sickness, the testing? How can the school district and the city work with the community to make sure that we're reaching out to those diverse populations who speak different languages?
Right. So if people really want, I always say communication is a two-way thing. You have to want to communicate and you have to want to be communicated with. If people do want to know what's going on, they can go to our website and really access practically anything they need to know. And my understanding is you can actually apply. There's an app you can apply to it that will translate into the language of your choosing for you. I think it's a Google app. So that's available. We've been, my staff, I've got Anna Quimby, who's my assistant, doing an awful lot of translating into Spanish. I've been reaching out to Spanish Radio, to Univision, to the Reyes Media Group, been on Spanish language Facebook live posts, just trying to get the word out in Spanish, and reached out as well to the Hmong community. There's quite a bit that's going out from the school district, I believe, on this as well. And I will say this, and then I've got to go, but I was disappointed when we reached this crisis that, for instance, we did not have at the unified government the email or the pastors' names or the telephone numbers of the 400 churches in Wyandotte County. I just don't understand that, how we do not have that communications channel in place, ready to be used at a time. And we're trying to build that database now. So it's exposed a lot of things that we need to work on. It's also exposed or shown, the real character of people and of organizations has revealed during this. And it's a great time to pay attention.
All right. Well, we want to thank you, Mr. Marion. I know you've got to go to another call. I want to thank everyone for being on this call today. We really appreciate it. If you have any follow-up questions for the mayor, if you want to send them to the chamber and we'll get them to the mayor, or you have any additional comments you want to send to him, we'll make sure we'll compile all that information and get it over to him to have a look at and get the responses back out to everyone who was on this call today. I want to thank everybody for being here. Thank you for your service, for all that you're doing for the community. I know this isn't an easy time. I tell my friends when I joined the chamber, I was expecting a different business environment than the business environment I'm dealing with now. But, God put us here for a reason. And so I am grateful for the opportunity to serve the community and what we're doing every day. And I am thankful to you for being here. So with that, I will bid everybody adieu. Have a good day. Stay safe. Stay healthy.
Thank you all. Thank you.